Have you begun to receive any shipments?
We haven't, but what we've had to do over the last several weeks is plan very diligently for the first shipments of the vaccine. That's involved the plan for actual administration, including setting up lanes similar to an assembly line eventually for our own healthcare workers and then for the community, but also very close coordination with the New Jersey Department of Health and Operation Warp Speed. This is going to be a very complex process. The cold storage requirements are very complex, requiring unique packaging, but also, of course, the refrigeration equipment. We're one of just several hospitals in New Jersey that has the ability for ultra cold storage. And so we'll be one of the few getting that first shipment, and we'll be testing the very complex logistics in the coming weeks.
That is one of the areas I really wanted to talk to you about, because it's fascinating to me, excuse me, that this, and I believe it's one of the other vaccines, require that super cold storage. There can't be that many places in the country, and you've said only a half dozen or so in the state of New Jersey, that can accommodate that. So how do we do this at the scale that we're going to need to do it?
Well, there are definitely more places in the state that can do it. We are one of the few that are going to be assisting in the planning process. But you're right, that's going to be a bottleneck generally throughout the country. The fact that the virus, the vaccine rather, has to be stored at negative 94 degrees Fahrenheit, really dry ice temperatures. They had to load the planes coming from Europe with the initial allocations of the vaccine with 15,000 pounds of dry ice. So this is going to be a major limiting factor, which is why we've had to plan so diligently over the last several weeks. But I'm confident that we'll be able to do the first rounds of administration.
Forgive me for being dense here. The vaccine, I take it, then does not freeze solid at negative 94, does it?
It does get to a state where it can be preserved, and the entire idea is once it thaws, you have a certain amount of time where you can give it and you're sure that it will work based on the clinical trials that were done and many of the basic science work that was done. So
I see. So you thaw it briefly so it goes to a liquid form at which it can be injected, but you can't let it thaw and sit there or it loses its potency.
Exactly. If you thaw it and it sits too long at room temperature or warmer temperatures even than negative 94 degrees Fahrenheit, the vaccine is compromised and likely will not work. And so that's why up to the point of distribution and administration, it has to be kept at that temperature.
Let's talk about a couple of other things, and beginning with the idea that we have tens of millions of people in this country who are in the at-risk category, and we have hundreds of millions of people who are probably going to want to be vaccinated. Are you down with the idea that we will have vaccinated a large portion of the population of the United States by the middle of next year?
Well, we hope that's the case. And the real rate-limiting factor, I believe, will be adoption. We have to make sure that trust is earned with the American people with this vaccine. That starts, of course, with our healthcare workers. As you mentioned, the ACIP meeting earlier this week actually required that nursing home and hospital healthcare workers be the first to receive it, in addition to nursing home residents. And that will be a test phase for willingness to get the vaccine. We've done surveys at our hospital with better and better results over time with trust in the vaccine. But I do believe that will be the rate limiting factor to achieving what we want to into the middle of next year.
You'd take it and you'd have your loved ones take it, I assume.
I would. And in fact, I was a clinical trial participant myself in the Moderna trial, which we did out of Rutgers, New Jersey Medical School at our hospital. For one, to be part of the national solution, but also to demonstrate to the community that we would not be offering a trial that we didn't think was safe for ourselves in addition to them. And so that's going to be a major factor going forward.
Shepard Smith here. Thanks for watching CNBC on YouTube.